Hello everyone, I am dietitian Mrs. Neeru Malhotra from Chaitanya Hospital, Chandigarh. I have been associated with this mother and child nursing home for past several years. Our mission here is to provide good health care by proper medication and also through good food. In the hospital we have an in-house kitchen and a cafe to promote healthy eating for all admitted patients and for outdoor patients as well. We take care that we do not add any color, preservative or Ajinomoto in all the dishes that we serve to our patients. As we all know, nutrition is the basis not only for physical health but also for mental health and social well-being. So I firmly believe that a sound mind in a sound body, in a sound family and in a sound environment is what health is all about. Now, how to get so much of soundness in health? Well, we'll discuss about this now. Like, you can get all this soundness of health through a balanced diet. Now, what is a balanced diet? This is a diet where different kind of foods are taken in a certain quantity or proportion so that all the calorie, protein, vitamin, mineral, fats, all requirements are met with. So we have grouped various foods into certain food groups, like we have cereals or whole grains, which includes all types of cereals. Then pulses and its products. Then we have vegetable and fruits. Then we have milk and its products. Then fats, sugars, butter, then most important, water. Now, to achieve a balanced diet, we require some amount of food from all the food groups that I have just mentioned to you. Then, now let us compare our body to a house. We all want to live in a very strong, comfortable house. So many materials are required to build up a nice, clean house, right? So let us show you through a small picture. Just a nice colorful house. What all it requires? Bricks, cement, sand, bajri, iron, tiles, water, wood and finally the paint, right? Similarly, to make a healthy body for a boy or a girl, you require various type of food groups like, see this picture, roti, rice, dals, oils, butter, gur, honey, vegetable and fruits, milk, water, seeds, etc. So all these things, if we take in a certain proportion, only then we are able to make a balanced diet. Now let us make it more clearer to you. What happens? You can see this weighing scale. I call it a balance, right? When there are two pans in this, when both the pans are equal, then it is correct weight. So now, if in a diet there are more proteins than required by an individual, then also the balance tilts. Second scenario is, if there are more fruits and vegetables and less of other food groups, then also the balance tilts. Similarly, if we have more breads, pasta, cereals, refined flour, chips, etc., then also the balance tilts. So now we have to maintain an equilibrium. So a healthy diet, so you include all the food groups in certain proportions, only then you will get to make a balanced diet. Now, why I want to discuss all this with you is that these days a major problem is lurking over us, and that is of childhood obesity. So what is happening? What are the causes of obesity? Well, the first and foremost cause is the genetics. Maybe a child born to obese parents, maybe having more predisposition to more fat cells in the body. Then there is a large decrease in number of mothers who are breastfeeding the child. Mostly children are kept on infant formulas these formula-fed babies are more prone to obesity. Then children have become more involved with TV, video games, computers, mobiles, etc. There will be ads on TV, which can really force a child to have an unhealthy appetite, right? Or binge eating would be there. So nowadays children are not walking up to their schools, they are not cycling up to schools, they are being dropped. Another reason I find is enormous increase in eating out in restaurants, which is being introduced to a child very early in their lives. So much of salts and sugars, extra food is going to the child. Then there is much reduced sleeping time with children. They are more stressed out with all the school curriculum and all that. So all this leads to obesity. You may ask me, what is obesity? Well, you all see a plump or a cuddly child, you like it, right? But according to us, if a child is 20% above the normal weight for his age or height, then we call it an obese child, right? Now, this can lead to so many problems in a child's life, like you are predisposed to diabetes, hypertension, heart problems, liver diseases, sleep problems, early puberty, asthma, skin infections, and so on and so forth. So, it is high time that we take a lot of care in introducing foods to a child's life at proper timings, reduce the intake of salts and sugars. We introduce it quite early in an infant's life also. After 6 months I find that some biscuits are being fed or the processed cereals are being introduced. So they all contain salts and sugar when a child doesn't require. So we need to have a control on this, and I would request all the parents to take proper care for a child's diet. It is very important. You must learn about proportions and the quantities of food that has to be given to the child. So do consult your physician, to your dietitian, and take help of that. I would want that please shun out 3 whites: refined flour, sugar and salt from the child's diet. Now, I will just show you what foods I have listed as danger foods for children. So, you are all familiar with this sign. This is a danger sign you always find on electricity pole. So, I have used it to demonstrate how foods are harmful to us. So, chips, colas, laddus, barfi, matti, biscuits, ice creams, Ajinomoto, color, preservative, Maggi, right? And namkeens, patties, samosas, toffees, chocolates, so on. So our children are being exposed so much. So what they see, they go for it. They want to eat, right? So let us learn to control their diet. Thank you so much.